And now, for the one surprise that we have on the agenda, we'd like to present the Ornstein Award. The Ornstein Award, Margaret G. Ornstein Award, is given for an outstanding contribution to nursing. It is with great pleasure that the Public Health Nursing Section awards the Margaret G. Ornstein Medal to Nonceba Lubanga. You would come up, please. As they say, Nonceba Lubanga, this is your lucky day. You know, it seems only fitting that when we're talking about Public Health Without Borders, that we honor this courageous woman. She grew up in Transkei territory of the Union of South Africa's Cape Province under the apartheid government, the white African nationalists, where her people lived under curfews, were prohibited from protesting, and were restricted from leaving their community. Her mother was a midwife, and her father worked in the apartheid government's Department of Agriculture. They never believed in apartheid, but the government income was needed to support their 10 children. Our honoree was the oldest, and she chose nursing because the apartheid government paid for her education, plus a small stipend. She received her RN with honors from Livingstone Hospital in Port Elizabeth, South Africa in 1963, and a year later she became a midwife. As a midwife, she did home deliveries and care, and she worked in hospitals. She experienced the segregated, non-white healthcare system as severely underfunded and understaffed for very sick populations. In the hospitals, there were 2 patients to a bed. Hundreds lay on floors. The food was cooked in an outdoors environment, and patients had to walk outside in the cold to get their food. Linens were used by more than one patient before being washed. Healthcare facilities were located far from the non-white communities, and thus a number of persons died before they could receive care. Every nurse was required to be a member of the apartheid regime's controlled South African Nursing Association, or SANA. This association's constitution did not allow non-whites to be in its leadership. SANA supported the apartheid police to help arrest nurses of color who protested their working conditions. The apartheid government required SANA to keep lists of every nurse by race. The regimen restricted the travel of non-white nurses from their communities. The only way that our honoree was allowed to leave her homeland was because she received scholarships to study more nursing in England. She went from England to New York in 1970, where at Columbia University she met other healthcare providers who were also exiles from South Africa. They joined together in a commitment to try to influence national and international leaders to stop apartheid, especially for nurses, physicians, and for the healthcare system in South Africa. At the 1975 ICN meeting in Mexico City, the SANA was told by ICN that they had to allow nurses of color in their leadership. The SANA nurses became so defiant that they walked out of the meeting. In 1993, as a board member of the Committee for Health in South Africa, Nonceba represented the new South African Committee of Concerned Nurses who were against apartheid and wanted to stop the ICN from supporting SANA. ANA and ICN supported CHISA and the concerned nurses. Nonceba co-authored a resolution adopted by the 1988 APHA Governing Council condemning apartheid against nurses of color, and a similar resolution that the National League for Nursing adopted in 1991. She influenced national and international leaders in healthcare to work together to stop apartheid. She is copied on a number of letters that attest to her effort. She has authored and co-authored more than a dozen publications on the plight of black nurses and the healthcare delivery system conditions in black South Africa. Today, she actively works with the Democratic Nurses Association of South Africa as they host the 2009 ICN meeting, which will be the first ever in South Africa. I'd like to just read a couple of excerpts from some of the letters that we got. First, from your brother, who describes his sister as the reason that his siblings got to go to school and the reason that 13 of her brothers and sisters' children, 10? She also put her brothers and sisters' children through school. He describes her as the reason he's in medicine today, that without her assistance to get him funding, he would not have been able to attend medical school. Diana Mason, the editor-in-chief of the American Journal of Nursing, identifies Nonceba as an activist in health, social, and human rights issues during South Africa's dark days of apartheid. Dr. Mervyn Susser from Edinburgh identifies Nonceba as a wholehearted activist in the cause, not only of her fellow nurses, but in particular in the cause for all those engaged in the decades-long South African struggle of those oppressed.
I remember when I first went to present my resolution against the South African Nursing Apartheid organization, I went to the public. Dr. Physics, Charmaine Physics, one who actually, took me by the arm and made me go through the names of people. He said, go to the public nursing section, and they will, help you, with the promoting and making sure that it goes to the governing council. So I went in there, and at that time, it was Dr. Carol Isley, who was the chairperson of the public health nursing section. I went in there and I laid my cause, and some of the nurses were saying, well, this is unfair of us, to really take this political issue, because even in this country, nurses are not involved in political, issues. We really shouldn't be, involved in this. So at that time, my heart just sank. What am I going to do? I just picked, get into this very deep Xhosa accent, and I said, I was trained in South Africa, and I know what it is like to go under and be under the oppression. At that time, everybody, whoa, where? No! and over the years, the public nursing section, and of course with the rest of the APH, have been very, very supportive, of our struggle in South Africa. And I'm happy, as Jean said right now, to say, through your efforts as well, the South African Nursing Association is no more. We now have the Democratic Nursing Association of South Africa, DINOSA, which for the first time, hosting the International Council of Nurses Conference in Durban, South Africa, on June 27th to July 4th. I know, you think it's summer, but over there it's winter. But don't be discouraged. Where it's going to be is kind of subtropical, the weather there in Durban. It's near the Indian Ocean. So please, please, do go to South Africa. And the Secretary General of DINOSA has charged me with the duty of trying to promote DINOSA here. And I know all of you are going to go. And thank you